CNA practice test for Florida. Question 1. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately. Question 2. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 3. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 4. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 5. A resident with Alzheimer's disease is wandering the halls. What should the CNA do? Lock the resident in their room. Tell the resident they are being naughty. Gently redirect the resident to a safe area or activity. Tie the resident to a chair. Redirection is a safe and effective technique for managing wandering behavior in dementia patients. Question 6. How often should a resident who is unable to move be repositioned? Every hour. Every 2 hours. Once per shift. Only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 7. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 8. What should a CNA do before entering a resident's room? Walk right in. Knock and wait for permission to enter. Call out the resident's name from the hall. Check the resident's chart. Knocking is a matter of respect and privacy for the resident's home. Question 9. What is the correct way to lift a heavy object? Bend at the waist and keep legs straight. Keep feet close together. Bend at the knees and use leg muscles. Lift with your back muscles. Proper body mechanics involve using the strong leg muscles and keeping the back straight to prevent injury. Question 10. What is the most effective way to prevent the spread of infection? Wearing gloves at all times. Washing hands frequently. Using antibacterial spray on everything. Keeping all residents in their rooms. Hand washing is the single most important practice in preventing the spread of infection. Question 11. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 12. When dressing a resident with a weak right arm, which arm should be dressed first? The left arm, the right arm, both arms at the same time. It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak. Question 13. A resident is choking and cannot speak or breathe. What should the CNA do? Perform the Heimlich maneuver, abdominal thrusts. Offer the resident a glass of water. Wait for the nurse to arrive. Hit the resident on the back. Abdominal thrusts are the standard emergency procedure for a conscious person with a complete airway obstruction. Question 14. Which of the following is a sign of dehydration? Clear, pale yellow urine. Moist skin. Dark, concentrated urine. Increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 15. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 16. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 17. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 18. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 19. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately. Stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 20. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes. Every hour. Every 2 hours. Once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation.